Hello again, it's Carolyn here, Trichologist, Absolique Hair Health Clinic. Just want to share with you what we actually do here at the Hair Health Clinic. The first thing we do is diagnosis. So we use a microscope, and the skills as a trichologist understands because they have studied the science of the hair and scalp. So we can read the scalp and the hair coming out of the scalp through the microscope to see whether there is hair loss or hair thinning, because we also understand the big difference between hair loss being the hair cycle and hair thinning being a general diffuse hair thinning or a pattern thinning related to female or male pattern thinning. The other types of things that we diagnose are trichotillomania, that the client normally knows that they have trichotillomania, and also the different forms of alopecia. So you have the alopecia areata, which is the typical patches, and these days we're seeing it in all different forms over the scalp. On top of that, there are so many other types of hair loss, hair thinning, and also the scalp problems that can happen to do with the follicle. So we can see those types of things under the microscope. So once we know what it is, if it's the general hair cycle or a hair thinning, we know how to treat it. You know, it's non-medical the way we go about treating it, and it's natural and it helps. But when we have things that are to do with the body, when it gets very medical, we need to work with your doctors. So you need to understand that the doctors will help you when you have things like iron deficiencies, diabetes. We have a lot of thyroid disorders as well, and I'm seeing a lot of different, quite extreme types of autoimmune disorders that we can't fix those types of things. So we have what we call a symptom and a cause. And most of the time we need to work together with the specialists and the doctors, and they can help treat the cause, especially when it is medical and very health related, whilst we look at the symptoms of the hair thinning or the hair loss that's associated. So we're non-medical. You know, we're treating the hair cycle, the hair cell, and the pattern thinning, and we know how to fix that. But when the cause is inside your body, we have to work with your medical doctor. So sometimes people think that we can fix everything. So we're specialists about hair, but we do need to work with others. So I hope that just makes it a bit clearer about specifically what we do here at Absolique Hair Health Clinic. Is we're focusing first on diagnosis, the hair cell, the hair cycle, the type of hair or scalp problem that you have, and then offering a treatment that can work together with your medical practitioners as well. So thank you so much.